rt.ae. Quick Art, freshness delivered daily.
There's more news, and one being from the health sector. UAE has seen a drop in heart attack deaths, but the risk of heart disease rises among young adults, and this is as per the UAE report jahan pe aaya hai, and doctors are warning that lifestyle factors are fueling a rise in heart diseases. So even as heart deaths continue to reduce in the UAE, overall cardiovascular diseases continue to surge, which grows particularly among the younger population. Doctors have warned all of the cardio, associated diseases being the risk factor for leading to heart attacks. So iske liye we've got Dr. Yasir, cardiologist. Dr. Yasir, can you break us down in terms of the details of what leads to the cardiovascular diseases which are impounding to heart attacks?
Thank you. Thank you very much. So I'm Dr. Yasir Parviz. I'm one of the intervention cardiologists. So as you highlighted, that the leading cause of death all over the world is still cardiovascular illness. And in UAE or in Middle East, we are seeing in comparison to European countries that the heart attack happens, and it happens in a younger age. So to be honest, there are a few things that we cannot change. So we cannot change our genes or genetics or our parents or where we come from. So unfortunately, the South Asians have a higher incidence of heart problems. But there are a few things that we can change, like our lifestyle. And there are a few factors like controlling our sugar, looking into our blood pressure, maintaining our high normal cholesterol, not smoking, having or trying our best to have a stress-free life, and enjoying ourselves will try to reduce your risk of heart attack. So as an expert in the field, I'll try to tell you that lifestyle is one of the things that we can do to try to help reduce the impact of heart attack or the incidence of heart attack in the Middle East.
So, Dr. Yasir, at 𝐄𝐸𝐬𝐻 Hospital, we would like to know, your patient history in that. What have you figured out as cardiovascular disease, as implications leading to heart attacks? What are the areas that, we need to watch out for?
Okay. So, thank you very much. I'll just make a small correction. Currently, I'm in Emirates Hospital Group. Okay. So, it's one of the leading groups here in Dubai. So, we are seeing a lot of heart attacks in our routine practice. And what we are seeing is that heart attack is mostly because of unhealthy lifestyle, and the incidence of diabetes and hypertension is very high. So if you think about, let's say, a virus pandemic like a corona, if I say to you that diabetes and hypertension is leading up into pandemic in the Middle East, so this is one of the contributing factors, and unfortunately then leading to unhealthy lifestyle, obesity. These are the reasons that we see a lot of patients coming with heart attack to our hospital in Emirates Hospital Group.
Dr. Yasir, what are the latest treatments and interventions that you've seen in the last few years that is there to reduce the heart attacks?
Yeah. So I'll tell you that as an intervention cardiologist, we are the keyhole surgeons, or we are the ones where we treat the heart attack by a very, very minimal invasive incision through a wrist. So we can go into the artery within minutes by a small prick or a needle stick into your wrist, and we can go and see the blockage where it is and unblock the artery by a procedure called balloon and stenting. This is called primary PCI, and this is the gold standard all over the world. And we are very lucky here in Dubai that we are able to provide this treatment immediately. But the request to the patients is that they should come and report to the doctor immediately, because if there is a delay, then the chances of unblocking the artery are less. And similarly, heart is a muscle, and the time is muscle here as well. So we don't want the patients to be delayed. So we should try to get, as soon as you get any symptoms, any concerns, you should report immediately to the doctor, and he can treat you. As an intervention cardiologist, we have the cath lab facility we can treat. To be honest, there are too many new techniques and gadgets available now where we can predict the heart attack, we can diagnose the heart attack early. But the request to the community is that they need to see an expert as soon as they have any concerns.
Doctor, like you rightly said about, watching out for symptoms, could you list out a few symptoms for us and some warning signs that young adults should watch out for?
Thank you. So it's very common that people will ask us, what are the symptoms of a heart attack? So commonly, it is like you will get a pain discomfort in the chest. It is like maybe sometime heaviness or pressure sensation. If you feel that you are getting some unusual sweating or difficulty in breathing or your heart is racing, it might be an alarming sign that you might be having not enough oxygen going to the heart muscle, and that's why your heart muscle is telling you that please see an expert. But at the same time, as an expert, I'd like to highlight that not everyone is going to get central heavy pressure sensation, particularly in patients who are diabetics. And in female, we might have some unusual symptoms. So even if you feel just fatigued, and even if you feel that you are not able to cope up with your peers or not able to do the things that you were doing before, it might be an early signs of a heart attack. People with diabetes, unfortunately, there are many occasions then they don't have a chest pain and they come to you. So any uneasy feeling in your chest, please consult a cardiologist.
Thank you, Dr. Yasir, for joining us on the show and for detailing out on the heart attacks and the risks that we are associated with these days and to better take care of our heart health. Have a good day, Doctor.
Thank you very much. Yeah, absolutely. And the heart health matters. Thank you.
Absolutely. Thank you, Doctor.
Thank you.